The overwhelming odds are that your child suffers from one of these unhealthy medical or social conditions. In fact, 9 out of 10 kids in America are experiencing one or more of these problems every day. They seem to be totally random with nothing in common. However, research over the past 20 years has linked each of these conditions to a common cause. Children's sleep disorder breathing, SDB, is a physical disorder that causes disruptions in a child's sleep pattern. Sleep disorder breathing causes a reduction in the amount of oxygen that a child's body and brain receive during sleep. They don't get the kind of restorative sleep that a growing child needs, and they end up being chronically tired. Children with SDB usually sleep with their mouths open as they try to get more oxygen into the lungs. Now you may be asking, if it works for them, what's wrong with breathing through their mouths? First, let's talk about what's right about breathing through our noses. We'll start with filtering. The nose is designed with lots of hairs and mucus to filter out germs, allergens, and dust. Some do get through, but the nose does a very good job of cleaning the air we breathe. Now let's talk about humidity. The air around us is almost always too dry for our lungs, so air coming in through the nose swirls around in the sinuses to moisten and warm it before it hits the tissue of our lungs. Moist air transfers oxygen into the bloodstream through the lungs more easily. Mouth breathing doesn't offer any of those benefits. However, the real problem with mouth breathing doesn't have anything to do with filtration or warmth or moisture of the incoming air. Do you see the problem in all of these photos of mouth-breathing children? That's right, all of their tongues are laying on the floor of their mouths. Well, of course, they'd have to be. If their tongues were pressed against the roof of their mouths, no air would come through. So the tongue has to stay locked to the floor of the mouth, and that's the #1 problem. Why? Because in addition to the tongue's day job of learning to talk and maneuvering and positioning food in the mouth so that we can chew it, and learning how to whistle, learning how to get the pit out of a cherry, and mastering the art of licking an ice cream cone, the tongue has a night job as well. It pushes the top teeth outward toward the cheeks and lips, allowing the upper and lower teeth to mesh perfectly. As it pushes the teeth outward, the tongue also widens the palate. When the palate is widened or expanded, it pulls the roof of the mouth down. That opens the nasal airway so that the child can continue to breathe easily through their nose as they sleep. What exactly causes sleep disorder breathing? Of course, genetics is always a factor. The child may have been born with a tongue tie, where the frenulum, that little flap of skin under the tongue, is holding the tongue down. This is easily treated with a quick procedure at the dentist's office. However, there are other controllable factors that contribute to narrow or compromised nasal airway. Widespread use of pacifiers and bottle nipples in the modern world is mostly to blame for this relatively new wave of childhood problems. In this illustration, the red circle represents a pacifier nipple. As the child sucks on the pacifier, the tongue presses it into the roof of the mouth. The palate is then pushed up into the nasal airway, making it smaller and smaller. Another major contributor is the decision to wean a child onto soft and pureed baby foods. Mushy baby foods don't require the child to chew. That tricks the child's developing jaw into slowing its growth, while the rest of the face continues to grow normally. This moves the tongue and jaw back into the throat, constricting the airway in the throat. The face takes on a distinctive receding chin look. This is an actual patient's x-ray at 8 years of age. Notice how the tongue and jaw are constricting the airway. You're probably thinking, why didn't anybody tell me this before? And I can't go back and change the past now. Well, the truth is that much of this information and the connection between children's behavior and social problems and sleep-disordered breathing wasn't confirmed until relatively recently. However, I have good news. While it may not be possible to go back and change the past, we can now go forward and change the past. A qualified sleep dentist can now offer a program of treatment which will not only stop, but actually reverse the damage done to your child's airway and to the child's facial structure. It's called guided growth, and it can bring health, well-being, and a happier life to your children now and in the future. Guided Growth is a do-over program for kids. As parents, we can't go back in time and change the actions that we now realize harmed our child's breathing. However, the harmful effects can be reversed. Remember the x-ray of the 8-year-old boy? Here is his actual x-ray at 13 years of age after following a guided growth program from his dentist. Guided Growth uses oral appliances, nutrition, oral exercises, and palatal expanders to allow facial and oral structures to catch up to normal. And prompt treatment now can prevent further SDB effects in adulthood, like migraines, heart disease, chronic respiratory disease, cracked and broken teeth, and TMJ disorder. How do you know if your child has sleep disorder breathing? There are common signs of SDB. Crowded teeth. The child's teeth don't have enough room to come in naturally. Noisy breathing. Breathing through the nose is like sucking a malt through a flat straw. Noisy. Swollen tonsils. Mouth breathing does not warm or moisten the air. The tonsils and adenoids can become chronically dry and irritated. An overbite or receding chin. The constricted tongue is pushed back into the airway. 24/7 mouth breathing. The child breathes through his or her mouth both day and night. If you suspect that your child may have sleep-disordered breathing, call our office for an evaluation appointment. The sooner that we start treatment, the sooner your child can start living a normal and happier life.